Hey guys, Dr. Barker here, and I want to talk to you today about scoliosis. What is scoliosis? How did I get it? What the standards are, and most importantly, what to do about it. So if you're watching this video, chances are that you or a loved one has been diagnosed with scoliosis, and most likely, if you're a kid, you remember when you were in the gym and they had you bend over and touch your toes, and they sent you to the school nurse, and now you're at the doctor's and you've been diagnosed with scoliosis. It's overwhelming. What do I do about it? So what is scoliosis? It's actually a lateral tipping of the spine. It's literally when your spine looks like a cobra snake. Now, people always ask me, how did I get scoliosis? There are genetic factors. Maybe you had a trauma, but most times the word is used idiopathic, meaning they really have no idea where it came from. But most importantly, you have it. What do we do about it? So there's three categories of scoliosis, but the first one I want to address is if you have 1 degree to 9 degrees, it's not considered anything. The question is, if you have an 8-degree curve, is that good or bad? Yeah, the problem is it eventually will get worse, but if you have a curve between 10 degrees and 24 degrees, that's considered mild scoliosis. And if you've gone to the orthopedic surgeon, the standard of care there is something called watch and wait. It's observation only. We literally do nothing about it. And my question is, if a tsunami was about to hit you, would you literally watch it come at you? No one would do that. So the thing is, with a mild curve, the odds of progression is about, the research shows, about 68%. Now, if you're watching this, if you're 25 degrees to 39 degrees, it's something called moderate scoliosis. Now, if you've been to the orthopedic surgeon, half of surgeons will say something called watch and wait. The other half will recommend a hard brace. A brace literally, as hard as a wall that people have to wear anywhere from 19 hours to 23 hours a day. The problem with bracing is this. If any of you guys have broken a bone, a leg, or an arm, I know I have. When you put a cast on your arm, when you pop that cast off eventually, are the muscles stronger or weaker? Yeah, they're a lot weaker. The muscles literally atrophy. When you wear a brace, hours and hours and hours, over time, when you pop that brace off, the muscles become weak and you literally buckle worse into something they call severe scoliosis. So if you're watching this and you've been to the surgeon and you're over the 40-degree mark, you've now crossed over to something called severe scoliosis. Now, the United States has the most, I would say, aggressive surgical standards. We are 40 degrees. Canada's 50, New Zealand is 60. Some countries don't even have a number. But if you've crossed over the 40-degree mark here in the United States, you are now a surgical candidate. So if you see this image on the right, when they do scoliosis surgeries, does this spine look any straighter? No, it literally looks like it has a bunch of rods in it. The problem is your spine might be straighter, but if you are locked in that position, a lot of people that have scoliosis surgeries, they've lost function, they've lost movement, and over time, they show 4 or 5 years down the road, might have to do another surgery or causes severe health complications. So whatever range you have fallen in, you're probably asking, okay, well, what do I do? Now, I want to give you an alternative treatment option that we have available called our Accelerated Scoliosis Program. And, instead of forcing the spine in the position with braces or forcing it with surgery, we actually use the body to work with us, and we use something called a mix, fix, set. Now, the mix is, you could see, is literally people warming up their spine, moving the muscles in the right position. The second thing is set. It's when you move spinal adjustments to move the bones back into the correct position. Now, the other thing too is, the last thing is, we use a weighting system that works with your body to move the spine in the right position. And then we also follow it up with home care exercises. You're literally having this whole technique and system based on you to move your spine in the right position. If you do that, amazing things will happen. So I want to share some stories. There's a girl here. You could see her x-ray on the right. She went to the orthopedic surgeon, and guys, I encourage you, know your number, go to the surgeons, find out where you are. They did all their research and they said, there's no way I'm doing that. You could see her curve is over 40 degrees. But what she decided to do is our treatment program. Now, if you see this, Not only does scoliosis cause pain, but where do you see all those nerves go? People with scoliosis have a very high chance of things like digestive system problems, acid reflux, females, hysterectomies, hormone problems, sciatica, varicose veins, because all the nerves go to those areas. So this girl had all that, came into our process. 2 weeks later, this is her before x-ray. And what do you see with her new one? Amazing, literally reduced her curve by about 20 degrees in a short amount of time, 2 weeks time, reversed, canceled her surgery, and now we monitor her, changed her life, not only feeling better, but now we gave this girl, most important thing, hope back. Last one I'm going to show you is a girl. You could see this. She is in the mild scoliosis range. Doctor said, don't worry about it. Let's watch and wait. Family literally said, we feel like it's a prison sentence. We are watching our girl every day grow, spine grow worse and worse into the wrong position. And they literally were sick about it. She went through our program. About 2 weeks later, look at the difference. Not even on the scoliosis spectrum anymore. Now we monitor her. She's doing her exercises, and not only has her pain gone away, but her body is working better. Her digestive system has gotten better, because this is the thing. Before this, she was going to the bathroom, I think literally once a week. People with scoliosis have a much higher chance of digestive system problems and colon cancers, not because it causes that, because if you're not going to the bathroom, you are filled with toxins. So amazing story, transformed this girl's life. So again, I encourage you guys, do your research, browse this website, see if this program is good for you, if it works well for you, and I encourage you to ask me questions. I want to help you any way that I can. Again, Dr. Barker here, and I look forward to helping you.